Hello and good morning, or good afternoon, or good evening, depending on the time that you are viewing this. My name is Shanae, and today you are watching a video or a presentation on how to administer Narcan. So what I'm going to do is I'm going to start off by giving you some information on what Project Dawn is, how it started. From there, you are going to watch a really short clip on how to use the Narcan. And then from there, I'm just going to recap what was shown in the video, go over a couple of key points, and then from there, you will be all set and you will be ready to administer Narcan in the event of an opioid overdose. Okay, so let's get started. All right, so Project Dawn was created by the Ohio Department of Health. DAWN is an acronym for Deaths Avoided with Naloxone. Project Dawn's name originated from the witnessed fatal overdose of Leslie Dawn in Portsmouth, Ohio. Project Dawn started in 2012, and as of January of 2022, there are 108 Project Dawn programs registered in Ohio with 290 naloxone distribution sites. So where exactly is Project Dawn located? Well, the obvious part is in various parts of Ohio. Project Dawn is all about opioid overdose prevention, overdose education, as well as promoting harm reduction in every sense of the word. Therefore, Project Dawn can be found in or are partnering with local health departments, such as maybe your local health department. If you are living in Summit County, that's Summit County Public Health. SSP programs, community grassroots organizations, emergency departments, correctional facilities, and Project Dawn can also be found online. All right, now we are going to move into the video.
Overdoses can happen in a moment, but you can save a life by giving naloxone nasal spray, such as Narcan, in simple steps. First, check. See if the person is unresponsive or showing other signs of an overdose by shaking them, calling their name, or giving a firm chest rub. Call 911 immediately. Second, spray. Tilt the person's head back, insert the nozzle into either nostril, and press the bottom of the spray firmly. Third, breathe. Place them on their back. Pinch their nose closed and provide 2 slow rescue breaths into their lungs every 5 seconds, making sure the chest rises. If they do not respond in 2 to 5 minutes, give another dose. Fourth, recovery. If the person starts breathing on their own, move them on their side in the recovery position. To learn more and find free naloxone, visit ohagainstod.ohio.gov.
Okay, and moving on. So, if you're viewing this video, you may be asking yourself, why would I need a training like this? Well, the most important part is recognizing the signs and the symptoms of a possible overdose, knowing who is at risk, explain what naloxone is, how it works, as well as when and how to use it, and what to do if you suspect someone is experiencing a possible opioid overdose. So what exactly is naloxone? Naloxone, otherwise known as Narcan, Narcan is just the brand name, is a prescription medication that once administered attaches itself to the receptors within the brain and it blocks the effects of opioids. What this basically means is that the person who has received the Narcan, which meaning you gave them the medication, is sent into withdrawal. However, there is a peak and wane time. You have about between 12 to 20 minutes once it hits its peak, and then you have about 30 to 90 minutes once it begins to wear off. One of the things you are going to hear me state several times throughout this training is it is important to call 911 because if this medication wears off and the Narcan does not expel the opioid from the body. It just blocks it off temporarily just to get that person breathing again. They will go back into an overdose once it wears off. So it's important to call 911 first, as was seen in the video. What else do you need to know about Narcan? One of the most important things is knowing that Narcan cannot be exposed to extreme temperatures. What this means is that you do not want it to be exposed to extreme cold or extreme heat. Some people say that they want to keep or they have been keeping their Narcan in the glove compartment of their car. I usually advise against that because, once again, you do not want it to be exposed to extreme cold or extreme heat. The best rule of thumb is to just keep it in a bag. If you carry a bag, keep that medication in the bag with you, keep it in your pocket. You want it to stay at room temperature generally, excuse me. Also, there is a 2 to 3 year expiration date. If you were to have a box of Narcan and you were to look at the top, you will notice that there is an expiration date. You've got about 2 to 3 years before it begins to wear off, or the medication's effectiveness is no longer as effective as it would have been when you first received it. So let's say you have yourself a box of Narcan and it's expired and you're unsure of how to dispose of it. Well, if you live in Summit County, we have at most of our local police departments what's called the dump program. And what this means is that you can go to any possible, I won't say any, but most local police departments, they do have what's called an unused medication disposal box. You open that box up just like you would one of those mail boxes that you see on the corners for the post office, the little blue box. You open that up, put your medication right in there, or your unused medication right in there. No questions asked. Okay, so what are opioids? What's the difference between opioids and opiates? Well, one is naturally derived from the poppy plant, and then the other is synthetic or at times semi-synthetic. Most of the time, if you were to be prescribed an opioid, these are medications such as codeine, Vicodin, morphine, and in some cases fentanyl, usually on the street, or if you are using it illicitly, these are drugs such as heroin and most of the time it is also fentanyl. One of the things, especially if it's being used illicitly, fentanyl today, one of the most common forms that we've heard of is what's called pressed pills. And this is where they're taking fentanyl and they are pressing it to look like any other prescribed medication. So this could be being pressed to look like Adderall. It could be pressed to look like Percocets. It could be pressed to look like literally anything. Same color, most pills have like numbers on the back. It looks exactly like it, but it's fentanyl. Which is one of the things we tell people not to do, and that's do not buy prescription medication or borrow prescription medication from anyone if it was not prescribed personally to you by your doctor. Okay, knowing who is at risk. So, if you are someone who had just had major surgery, or you know someone who had just had major surgery, this is like your hip replacements, knee replacements, stuff like that, some heart surgeries, 9 times out of 10, that person was prescribed or put on some kind of pain management program, which could mean that that person was prescribed a narcotic. Let's say this is someone who took their medication earlier in the day, forgot that they had taken it, they took it again, they could be at risk for an overdose. Others, if let's say you were prescribed any of those medications that were in the last slide, and let's say that you have health problems, especially respiratory problems like COPD or asthma, that also puts you at risk. New users of long-acting opioids such as methadone, and high-dose users of prescription opioids. Who else is at risk? So those who were just released from jail and or treatment are at risk. A lot of times what people don't realize if they had just gotten out of jail or treatment is that during those periods of abstinence, your tolerance drops relatively quickly. What happens is that a lot of times people think they can use the exact same dose or amount that they were using before they went in. They get out, they think that they could use it, and then they end up overdosing. Also, users of multiple drugs, especially those that affect the central nervous system, such as benzos and barbiturates. So, how do you know if someone is experiencing an overdose? Does this person appear to be awake but unable to talk? Is their body limp? Maybe they're slouched over, pale face or clammy, blue or purplish fingernails and or lips, slow, erratic, or shallow breathing, heartbeat. Is it faint, hard to pick up or I'm sorry, making choking, gurgling, or snore like sounds. There has been people that I have personally heard say that they have had friends who they knew they were using. They thought that this friend was just sleeping off their high. What they did not know is that this person was experiencing what's called the death rattle. And in some cases, by the time they figured out that that's what that was, that person had experienced a fatal overdose. So that is something that you would want to be mindful of. Also, this person may appear to be unconscious and unresponsive. So what do you do if you believe someone is experiencing an overdose? As was shown in the video, and as I had said earlier, call 911 first, not after. Call 911 first. I know the video said to give the person the Narcan, then call 911. Well, I always tell people to call 911 outside of the fact that the Narcan does wear off. But because if you are in a state of panic, it may be hard to remember what exactly it is you need to do. What were all the steps that you saw in the video? What were all the steps that I explained in this training? Well, if you call 911, that dispatcher will walk you through the exact same process you saw in that video and the exact same process that I'm explaining to you or have explained to you. So always call 911 first. If you are unsure of what to say, you say, I have a person who has stopped breathing and is unresponsive. You always want to know that EMS is on their way, especially if you have given someone Narcan. And let's say that this person who received the Narcan was a pregnant woman. As I had mentioned earlier, if that Narcan sends that person into withdrawal and this woman was pregnant, not only is she going to go through withdrawal, but also that baby will be going through withdrawal as well, which means that her pregnancy or her baby will begin to experience distress. Also, look for the signs and the symptoms. Even if you don't see all the signs and the symptoms that I had mentioned in the previous slide and you only see a couple, or maybe you only see one, it's always better to Narcan the person and than not Narcan them. Don't guess. I always tell people all the time, do not guess. The Narcan has no harmful effect whatsoever. It only works on opioids. It does not work on anything else. So let's say this person is unconscious and it has absolutely nothing to do with an opioid overdose. Let's say they forgot to take their diabetic medication earlier that day or something like that. Again, that is also a reason why you'd want to call 911. Because if it is not an opioid overdose, that Narcan will not have an effect, and you will want to know that EMT, again, is on their way to give them the proper medical care that that person may need. Also, what was also mentioned in the video is that you will want to give that person what's called a sternum rub. And that is where you take your hand, you ball it into a fist, you put it right in the center of the chest, you push down and you rub. What this does is this activates that person's pain response. If that person ends up saying ow, or they moan or groan, there's a good possible chance that they may not be experiencing an opioid overdose. It could possibly be something else. But again, as I had said earlier, don't guess. It's better to Narcan them than not. When in doubt, give them the Narcan. The other thing as well, you will, as was shown in the video, have to give that person rescue breaths, 2 strong rescue breaths. But before you give that person rescue breaths, always check their airway for blockages. You do not want to try to give someone rescue breaths with anything blocking their airway, because then that could lead to further complications such as choking and stuff like that. As was also shown in the video, you want to make sure you give that person the Narcan nasal spray in both nostrils. Let's say you give the person the medication, both doses up one nostril. It's still effective. The most important thing is you want to make sure that person gets the Narcan nasal spray, okay? Okay, so let's say you're worried about, well, what if I give this person the Narcan and let's say they end up sustaining a bodily injury while I was trying to save them? Or let's say the person ends up still passing. Will I be charged or have to go to court for this person's passing or their injury? No. That's what the Good Samaritan Law is for. The Good Samaritan Law provides immunity for those who are trying to help someone either medically or non-medically. The other thing as well, let's say this is someone who is trying to help someone and they both were using at the time that that person overdosed. It also provides immunity for that person as well, albeit if that person was using and they do have drugs in their possession, it can only be enough that would produce a minor drug possession charge. If it is anything more than that, they are not granted immunity, unfortunately. You also cannot be on parole or probation, and immunity can only be granted twice. So there is that. Lastly, where can you get a Narcan kit? You can go to our website at cph.org, click on Programs, Project Dawn, and then /Summit Safe. And then you could also get a Narcan kit mailed to you as long as it is within Summit County. Also, if you would like to visit us, we are located at the Summit County Public Health Building, and that is at 1867 West Market Street. We are right behind Acme on West Market, and we are open Monday through Friday, 8 a.m. to 4 p.m. If you have a cell phone, you could also pull out your cell phone, turn on your camera, and you could scan this QR code. That will also take you to our mail order form, and that will get you set up so that you can get a Narcan kit delivered to you. And that is it. I thank you for viewing this video, and I hope that you are ready or feel confident enough to save a life if it ever comes to that. Thank you. Bye.